Biliary tract cancer is not a single disease. We know that there are different subtypes with different primary tumor sites, and these different primary tumor sites are associated with different molecular alterations. It's important to mention that up to 45% of the patients with cholangiocarcinoma or biliary tract cancer may have potentially actionable alterations, and now we have some very well identified molecular alterations with targeted agents available on the market or in clinical trials. We have the most frequently observed molecular alterations are FGFR2 gene fusions, IDH1 mutations, HER2 amplification, BRAF mutations, and others. For FGFR2 gene fusions, we have 2 drugs approved in Europe, Pemigatinib and Futibatinib, with excellent response rate around 40%, disease control rate around 80%, and with progression-free survival of 7 to 9 months and overall survival of 18 to 21 months in patients previously treated with a systemic therapy. For IDH1 mutation, we have 1 drug approved in Europe, Ivosidenib, and this drug was able to double the progression-free survival in previously treated patients and to double the overall survival. So we have these 3 drugs approved for patients with with actionable alterations. I mentioned the other alterations. We have drugs with positive phase 2 data for patients with HER2 amplification. We have the combination of Trastuzumab, Pertuzumab. We have Zanidatamab with Trastuzumab, deruxtecan, and other options, but these are not approved in Europe, at least so far. But in some cases can be available in early access program or in clinical trials. For BRAF mutation, we have the combination of dabrafenib, Trametinib, again not approved in Europe, but available in clinical trials or with other options. Then we have other alterations observed in a small percentage of patients, but we can have drugs for those alterations. So it's important to have a complete molecular profiling for patients with cholangiocarcinoma, so that the second-line treatment after the standard of care, that is cisplatin, gemcitabine, durvalumab, the second-line treatment can be defined according to the specific molecular alteration.